This is going to be part 2 of immunity, hypersensitivity, infection, and immunodeficiency. Allergy can be from an exogenous cause, something outside the body. It can be environmental allergens. Your allergens are things like dust, mold, fungi, pollen, food, animals, cigarette smoke. If I haven't mentioned it before, I'll mention it now. Smoking is hazardous to your health and the health of those around you. So it is something that should not be participated in. But you'll hear that again throughout the semester. Autoimmunity is where the body recognizes that your own antigens, your self-antigens, as foreign. This will cause disorders that are either organ-specific and localized or organ non-specific and generalized. Now, sequestered antigen is one that is hidden during embryonic and fetal development and then can cause damage when the damaged tissue releases that antigen. Infectious disease forms immune complexes so similar to our own antigens that they stimulate our antibodies against our own antigens. Original insult is when you have an antigenic alteration that results in destruction of your red blood cells. It also destroys thrombocytes or other cells, causing things like thrombocytopenic purpura or drug reaction. Genetic factors. Some autoimmune diseases are familial and are characterized by hypersensitivity. Systemic lupus erythematosus is one example that is fairly well known. This can be either organ non-specific. It is an organ non-specific disorder that is characterized by the production and deposits or deposition of circulating immune complexes containing antibodies against the host DNA. It is genetically linked, and it has also been associated with prolonged use of procainamide, which, if you remember from pharm, is given as an antidysrhythmic for ventricular dysrhythmias and or atrial dysrhythmias for the heart. And hydralazine can also cause it. It can be triggered by infections and environmental agents, such as ultraviolet lights. Risk factors for it tends to occur in women at a ratio of 10 to 1. The average age is between 20 and 40. And blacks have it 8 times greater than whites do. It causes damage to the tissues in the kidney, the brain, the heart, the spleen, the lung, the GI tract, the skin, and the peritoneum. And it can cause adhesions to form, which is where areas of tissue stick together, and it can cause fistula formation, where there'll be tracts open from one organ to another or one area to another. Symptoms include arthritis, rash, renal disease, anemia, cardiovascular disease, delayed healing, photosensitivity, presence of anti-nuclear antibodies. There's a whole list on page 179 in Huther. And in order to make a diagnosis, you must have at least 4 of those symptoms. It is characterized by remissions and exacerbations. Now, it's called systemic lupus erythematosus, just a little historical fact. It's called lupus because back in the 1700s, 1800s, they thought that it looked like a wolf bite, the rash that is formed. Systemic because it affects the whole body system, and erythematosus because it is erythemus, it means red. So it's a red rash that you see. It's a butterfly rash that usually occurs on the face that you'll notice. But that's why it's called lupus erythematosus. There is no cure for it. Now, alloimmunity is when the individual's immune system reacts against antigens of others of the same species. For example, transient neonatal diseases, transplant rejection, transfusion reactions, RH problems, or hemolytic disease of the newborn. The mom, in many ways, is sensitized to an antigen expressed by the fetus, and that is what causes the hemolytic disease of the newborn. And we'll talk about that a little bit further later on. Acute transplant rejection is a type 4 cell-mediated reaction that occurs within 2 weeks, usually as a reaction to the HLA or human leukocyte antigen that we have. That's why we need to do extensive pre-op transplant testing and treatment with immunosuppressants. It's usually lifelong treatment when you're going to do an organ transplant. Now we can do that with everything except the heart transplant because you don't have any time. You don't know that this person's going to die from some other cause, and so you can take their heart and they're automatically tested. So you don't really know that. So you can't do a lot of pre-op transplant testing for heart transplants. That's why acute transplant rejection is one of the common complications of transplants. We can also have a hyperacute rejection, which is very rare, but it's immediate. And when they put the tissue in, it turns white, and so they know it's not going to work. Or you can have a chronic rejection that occurs over months to years with gradual loss of function that can occur. Latex allergy is another type that is triggered by the use of latex proteins or additives that are used in making these items, and hopefully you don't have one because latex is very prevalent in the medical profession. Also, the latex gloves use cornstarch powder in making the gloves, and that cornstarch absorbs the latex proteins, and then it becomes airborne when those gloves are removed. And if you have a latex allergy, you oftentimes have a cross-sensitivity to bananas, kiwi, tomatoes, chestnuts, or avocados. And it can cause severe anaphylaxis or just a little skin allergy. It's a possibility. Infection is the #1 cause of death worldwide, in the entire world. We need to know the mode of action. How does it work? The damaged cell interferes with metabolism, making the cell dysfunctional. We need to know the infectivity. In other words, is it able to invade and multiply once it gets into the system? We need to know the pathogenicity. What's the speed of reproduction, the extent of damage that it occurs? Can it produce toxins or not? An example of an infection that causes worldwide problem, malaria, kills 1.5 million people a year, over 1,000 a day in Africa. So it's a disease that is easily taken care of and affected in this country. I mean, malaria in this country is practically unheard of, but in third world nations, it is really very deadly. Virulence is the number of organisms that are necessary to kill the host. In other words, one little bacteria, is that sufficient to kill the host, or do you need to have at least 1,000 bacteria in order to do that? So you need to know the virulence, the number that's necessary to kill the host. You need to know the antigenicity or the immunogenicity. In other words, its ability to produce the immune response. Can it do that? What's its toxigenicity? Is it able to produce endotoxins and exotoxins? What's the lines of defense that are present for that individual? What's the portal of entry for that bacteria or virus or whatever? Is it direct contact by inhalation, ingestion, or by the bite of an insect or animal like a vector? The first line of defense, of course, is our skin. Mucous membranes, digestive system, respiratory system, and the GU tract. That's why when you get a blister, you do not poke the blister. As long as your skin is intact, you have protection against infection. When you take a needle or you pinch it or whatever and destroy that blister so that it's no longer poofy and you've got serum leaking out all over the place, you've now opened the portal for infection. Digestive system, you need to make sure that the stomach is still acid. That's why you don't take proton pump inhibitors longer than 6 weeks unless you overproduce gastric acid initially, because otherwise you're getting rid of that first line of defense against bacteria, viruses, other things that we might ingest. Mucous membranes. In the respiratory system, we have the cilia. The mucus first that traps the bacteria, and then the cilia that move it back up to the mouth so that you can cough it out. But most patients swallow it, and again, you need to have an acid stomach in order to destroy that stuff. Your mucous membranes and your GU tract are all the first line of defense. The second line of defense is the inflammatory response. And the third line of defense is your immune system. And that does include your lymph system. And bacteria produce endotoxins during bacterial growth. I just want to comment before we go any further that there are some factors of the host that also can promote infections. The age of the individual. If the individual is less than 2 or older than 65, your immune system is either immature or starting to break down. Your immune status, if you are immunocompromised, you don't fight infection as well. If you have chronic disease, malnutrition, recent surgery, burn, some of the drugs that we take, such as our antibiotics, our steroids, and our chemotherapy, can affect our immune system. Radiation affects our immune system. So those are things that you need to take into consideration when you're trying to decide how dangerous this infection may be. Now, the bacteria produce exotoxins during their bacterial growth. And those exotoxins can be combated by various vaccines. For example, MMR or DPT, measles, mumps, and rubella, and diphtheria, rubella, I think, and tetanus. Your endotoxins are released during bacterial destruction. Now, endotoxins activate the inflammatory process, and that causes a fever, and increases capillary permeability, that causes a drop in blood pressure and edema formation. And endotoxins cause shock due to that vasodilatation, causing the hypotension, hypoxia, and activation of the coagulation cascade. Now, this can cause DIC, which is disseminated intravascular coagulopathy, which we'll talk about later. But the patient actually bleeds and clots at the same time. It can also cause septicemia, which means that you have bacteria in the blood with failure of the body's defense mechanisms to work. They can cause a widespread infection. Viruses are the most common affliction of humans. The common cold, the flu, affect just about everybody. They produce an antibody response in order, they must produce an antibody response in order to be resolved. And they function mainly by taking over the metabolic machinery of the host cells. They have no DNA of their own. They can initiate a latency period when the virus becomes part of the cell that can last for years. Think of your patients who have AIDS or HIV or cancer. And the vaccines will produce a primary immune response. We have fungi that are yeasts and molds. These are diseases that end in the suffix mycoses. Fungi that can invade the skin, hair, or nails are called dermatophytes. Now, dermatophytes can also cause diseases called tinea capitis, which is on the head, tinea pedis, which is on the feet, tinea curis, which is in the crotch area. It's called jock itch. So that the tinea can cause problems. Dermatophytes under your toenails, if you ever watched the commercials where you had the little yellow things with pointed ears and the tail that crawled in under the toenails and were only treated by Lamisil, which was advertised for months and months on television, and takes months and months to work to get rid of the fungus that's underneath your toenails. Symptoms are fever and itching, and you can have deep infections that can be life-threatening that invade the body, and you treat with things like diflucan, which is a trade name. There's a table on page 190 that lists the different types and the mode of entry for the different fungi. Clinical manifestations of infection: fever, because of the inflammatory response; fatigue, because your cell's metabolism increases and you're using up your nutrients, and so therefore you're getting tired because you don't have the energy you need. Malaise is an overall body fatigue that, again, is because of the nutritional deficit. Weakness, aching, and loss of appetite. Think about the symptoms you get from the flu. And remember, just being in bed for 24 hours, you start to lose 3% of your muscle mass, and you start to lose your bone mass. So you need to not stay in bed. Deficiencies in immunity and inflammation. The hallmark is a propensity for unusual or recurrent infections. They get them over and over again. Primary or congenital immune deficiencies are genetic abnormality. They'll have problems with their stem cells, their T cells, or their B cell maturation. White blood cell development may be arrested or disrupted in the fetus or in the embryo. There's a table on page 196 in your textbook. Nutritional deficiencies affect the immune function. If you have a decreased number of calories and protein, you're going to have a decrease in your T cell function. If you have decreased amount of zinc, you're not going to have B and T cell function that works well, and so you're not going to heal as well. So nutritional deficiencies really affect the immune function. Secondary or acquired deficiencies are those that develop after birth, like rubella, measles, cancer, infection, aging, or diabetes are all different types of acquired deficiencies that might occur. Now, diabetes is a problem with metabolism, and we'll talk about that when we get to the endocrine system. Acquired immune deficiency syndrome is caused by two retroviruses. The information is carried by RNA. A major immunologic finding will be that you have a decreased number of T cells, less than 200. This is AIDS. Your HIV virus destroys the helper T cells, suppressing the immune function, and it is a blood-borne pathogen, and it causes recurrent bacterial infections and extrapulmonary tuberculosis. There is a box on page 201 in Huther that talks about possible bacterial infections that may occur. But the symptoms will be weight loss, recurrent fevers, pulmonary infiltrates, cervical cancer. Early on, your symptoms are mild flu-like symptoms, so you don't really notice them. Maybe night sweats, swollen lymph glands, diarrhea, fatigue. These early symptoms can last for 10 years or more, up to 20 years, I've heard, without patients progressing from HIV to AIDS. With HIV, antibodies are formed after 4 to 7 weeks, if it's due to bloodborne products. If it's after sexual exposure, you can still test seronegative for up to 14 months. So it's really, really important that you have more than one test done to prove that you don't have HIV. And please remember that you can become seronegative in the late stages of the disease, because by that time you are so immunocompromised that you don't test positive for just about anything. So the time frame after exposure to the antibody formation is called the window period. In that window period, before you have antibodies, before you test positive, you can still transmit the disease, because during that time the bacteria is actively replicating. So it's something that needs to be addressed. And as HIV continues to AIDS, you can develop HIV encephalopathy, and this will affect the brain. This has a very insidious or sneaky onset. It's like it sneaks up on somebody. You don't really realize you have it. Symptoms are impaired concentration, memory deficits, apathy, social withdrawal, emotional lability. You'll laugh one time, you'll cry the next, for no reason at all oftentimes. Language problems, visual problems, psychoses, ataxia and abnormal gait, tremors, seizures, can develop central nervous system neoplasms. This information on this slide is from pages 390 to 392 in Huther, and you need to review that. AIDS will be covered extensively also in Nursing 121. So that completes part 2 of this lecture, and talk to you later.